I'll be talking about the work that we've done to establish a cancer registry in Kasumi, Kenya, a population-based cancer registry. Most of the cancer registries in Africa, there's the African Cancer Registry Network, is now, I think, has 29 countries. But in most countries, there's only one registry. And what we're trying to do is to go beyond the capital city, and in Kisumu is a secondary city, and try to build a population-based registry outside of the capital. I've been doing research in Kenya since 2001. And started on Burkitt's lymphoma, trying to look at the incidence and understanding the cause of Burkitt's lymphoma. And in doing that, began to realize that we don't really have an understanding of sort of the incidence of any of the cancers there. And so how do we begin to do that? So I've been working on this population-based cancer registry. Training is the number one challenge, to get cancer registrars to have the adequate training. So that's been, we've gotten some funding to send to our 2 registrars to get training. And thinking about, even with the cancer registrars, like how do they look through the data, the medical records, and understand what cancer is versus something that's not cancer. So education of the cancer registrars is an important part, and was not really a systemized aspect to that. The other piece is the medical records are in a state of just a lot of not very well put together, let's put it that way. So we try to look at all the different hospitals, laboratories, medical records, death records, trying to connect all the cases, but a lot of cases go elsewhere to get treatment, so we lose those cases. So we've had a lot of challenges. We're part of the Kenya Medical Research Institute. So Kenya has just established a National Cancer Institute. They've, as of February 2015, and Cancer Registry is a key partner with that. So we're with the Kenya Medical Research Institute. They have the one in Nairobi, which is the sort of the Ann Career who directs that, and is pretty amazing. And then in Eldoret, and then in Kisumu, and then we're trying to, the long term is to establish it in other sites throughout Kenya. Registry is important to know about both the incidence of cancer, so you can develop control programs and prevention programs. So direct resources for a country to understand, is there, what are the top cancers? Maybe we should focus on breast cancer for the major, if that's the predominant cancer, we should focus on that. Or if we see, for example, we see a high incidence of esophageal cancer in both men and women, and this is true in other African countries. It's not true, say, in the U.S. So then what would be the cause of that? So to know that it's very common and the high incidence, then how do we now sort of begin to understand why? Right now, the Kenyan government is supporting the development of the cancer registries and beginning to get buy-in and moving towards that. And there's a strong collaborative tie with the National Cancer Institute in the U.S. to help support cancer registry capacity building in Kenya. So, and a lot of other partners as well, AORTIC and the International Agency for Research in Cancer. But the NCI is making a big push to help the cancer registry capacity building. My data right now is at the point of we're just beginning and trying to understand it, so I wouldn't say the quality of the data is as robust, that it needs to be shared. But through the African Cancer Registry Network, that partnership of those 29, we're not a member yet, our small little registry, we're trying, but our quality of our data has to improve before we do that. I'm looking forward to getting to the point where we can use the data to really begin to understand the different types of cancer and incidence, and I think it'll be interesting when we get there.